how far are you willing to go? We're all going to die. So the question is, on what terms? Shouldn't people be able to write their own story, at least the ending to their story? Do people have to live continuously in pain? If you only have 6 months or less to live, and it was going to be the worst days of your life, what would you do? Well, what if you can choose to die while you were still here with your full mind and make an ending with your family and friends that's a pleasant one? Instead of waiting until you are in so much pain and draining you of everything that you once knew and loved about yourself. At this point, it doesn't only affect you, it affects everyone around you. Imagine that one of your friends or family is terminally ill and in severe pain. Would you want to see them suffering or know that they were at peace? Now imagine you could talk to your doctor about ending your life with a lethal dose of medication. A medication that you were prescribed and you would take on your own terms. I'm going to talk to you about medical assisted death and why it should be an option in the entire United States and not in just some of the states. Now, my main points are, what is medical assisted death? Where is it legal? And why should we have this choice? I've asked all these questions and want to make a statement about it. But first, I want to clarify what medical assisted death is, as it is often associated with euthanasia, which it's very different. According to What is Medical Aid in Dying and What It Isn't by Brandon Vogel, you first must verbally request the assistance to die at least twice with your doctor, in writing and verbally. The verbal times must be at least 15 days apart. And then after that, you must also have 2 doctors give you this exact same diagnosis. And you must have 6 months or less to live. You also must be at least 18 years old, mentally competent, and be able to take the medication on your own. You can't have any type of help with ingesting the drugs. So now that I've explained what medical assisted death is, now to tell you where it's legal. There's only 10 states in the United States with the District of Columbia, so that makes 11 places where you can go and have assisted death. Medical assisted death is legal in many of the states out west. When you get east, it's very, very far few and in between. Mainly all the same rules with minor differences. And the states where it's legal, not in any particular order, are Maine, New Jersey, New Mexico, Montana, Colorado, Oregon, Washington, California, Hawaii, and Washington, D.C. Oregon was the first state to adopt laws for medical assisted death in 1997, and New Mexico was the latest state in 2021. According to Compassion and Choices, they have been able to collect data from the doctors in these states that participated in medical assisted death and have said that it has improved the conversations between doctors and patients, and it makes the use of hospice care even better. And the physician training in end-of-life care is much better off as well. Lastly, why should we even consider this as a choice? Because it's our freedom to control our own end, not the illness. According to Compassion and Care again, it improves the end-of-life care. How? By having this as an option, it relieves the fear and anxiety of the patient. Just knowing that it's there calms them, even if they never choose to use it. It's the comfort of knowing that it's there and they can use it if they need it. Depending on the diagnosis of you or your loved one, given the side effects, they could be extremely awful. They could go from painful headaches to seizures, nausea, weight loss. You could even be in a coma. Now, no one wants to go through any of this, especially those types of conditions. So, is medical assisted death an option? Now, just because you choose to do this doesn't mean you have to do it. You can always go through with it, do all of the steps, get the lethal dose of medication, and hang on to it. No need to take it. According to Death with Dignity, 30% of the people who request the lethal dose do not even take it. Many of it's literally the comfort of knowing they have it there. Just knowing that they have it makes everything easier. Also, according to Death with Dignity, pain is not the number one request for the medication. The top 3 reasons for the requests are the decreasing ability to participate in activities that makes life enjoyable at 96.2%, loss of autonomy at 92.4%, and the loss of dignity at 75.4%. Now, watching someone suffer is heartbreaking, but having to live through it is even worse. The quality of life slowly disappears as you know it, making life seem pointless and a waste of time. When you're at this state, you don't want others to see you like this or even remember you like this. Now, to bring it all together, in some circumstances, living is worse than dying, especially when there's a ticking time bomb in your corner. The pain and suffering caused by the terminal illness may make life so agonizing and unbearable that death may seem like an act of humanity. And medical-assisted death is a way to die with your dignity. No one wants to see their loved one slip away and become weaker by the day. So I leave you with this. Would you consider medical-assisted death if you had 6 months or less to live? I mean, really give it some thought. Would you support your mother, father, brother, sister, or other family or close friend who chose to end their life with medical-assisted death due to a terminal illness because they couldn't bear with the pain anymore? I encourage you to give it some meaningful thought. Just how far would you be willing to go?